Hi, my name is Bob Christoffel. I serve as the manager of benefits education here at Wespath Benefits and Investments. We are coming to you live from our Spellmeyer studio in Glenview, Illinois. I want to welcome you to the Global Methodist Church Looking Forward webinar. It's great to have you here. We have had over 500 participants register for this event. The purpose of this webinar is to give you an update on the onboarding process of going into Wespath benefits from the Global Methodist Church, review the enrollment process and the steps that you might still need to take along that process, but also to give you an overview of the benefits that are available to you for eligible GMC clergy. This webinar is being recorded. You will be provided with a recording link following the webinar. We encourage you to ask questions as we go through this material. We do have subject matter experts working behind the scenes that will answer your question. We're also going to be raising up some of these questions throughout the webinar. There are resources attached to the GoToWebinar toolbox. We encourage you to download and print those resources. We realize that we have, just through the registration list, a really diverse group on today's webinar. We have former UMC clergy familiar with Wespath. A lot of you registered under that, and you are familiar with Wespath and the plans and our mission of caring for those who serve. We also have new GMC clergy, never served under UMC. We could have retired, active clergy. A lot of you expressed interest in different topics which we will be covering. We also might have hybrid, maybe retired from the UMC collecting benefits and now active in GMC. With me today is a very special guest. We have Rick Van Giesen. Rick, really appreciate you coming up, taking the drive here. It's good to see you so much better live than a recording. Rick, why don't we get started with just a few questions?
Sure.
The growth of the Global Methodist Church has really just been tremendous. For you, what's been the biggest challenge in your role as transitional benefits officer, just handling this rapid growth during the transition period?
Well, clearly, Bob, the challenge has been the sheer and unmitigated volume of pastors coming into the Global Methodist Church in a very short period of time. Between the beginning of May to the middle of August, we enrolled 724 pastors in pension, in the Global Methodist Pension Plan, and hundreds of health flex enrollments and waivers. When I worked in the conference office, I don't think we had more than 25 new enrollments in a single year in comparison.
Wow, just amazing, amazing growth. So where do you stand now, just in terms of the enrollment process for GMC participants and Wespath benefits? You know, I understand there's different steps along the way.
Yes. Well, we're in a much better position now.
Good.
Folks forget that I was a one-man show until the beginning of May. And then since the beginning of May, I am the grateful recipient of two very competent assistants, and one for pension and one for health insurance. And since they've come on, we have enrolled 1,000 enrollments in the various plans.
Wow, that is just amazing. It must have been, difficult being a one-man show. I'm glad you got some relief there. So what are the next steps really going forward for you and the Global Methodist Church, just looking forward?
I can think of three things that we're looking at in terms of the benefits office. One of our leaders is predicting that there will be 500 new pastors come into the Global Methodist Church before the end of the year. And again, that's a short time, so it's going to be a challenge to get everybody in before the end of the year. Secondly, we know that most salaries and pension contribution elections will take place on January 1st. So again, we're looking at a very short period of time to collect and enter data for 1,000 to 1,500 pastors. And so what we're going to be working on very quickly is a more efficient way to collect that data. And potentially, we may run a little late but we're going to do our best to get everybody in by the 1st of January.
So it sounds like much has been done, but much more growth coming, much more work coming down the road.
Yes.
Just one last one for you. What can someone expect just in this process, which many of the registrants express interest in, just moving from UMC to GMC?
It will take a fair amount of patience. We are asking processes and systems to do things that they were never designed to do. Everybody is working as hard as they can, Bob. There can be delays, but I was just thinking last night that from the first day that I attended seminary to when I was ordained an elder, there was a 5-year period that had elapsed between those two dates in my life. And I just want to say to those who are considering and those who are coming into the Global Methodist Church, it's not going to take 5 years.
Great to hear, Rick. Really appreciate that. Eligible clergy have a full range of benefits available, and we're going to focus on those 3 areas, give you some information, an overview. There's retirement, I'll cover that. There's health care, and there's welfare programs. Now, the retirement plan I'll talk about, many of you are familiar with the United Methodist Personal Investment Plan. This also is a defined contribution plan that has both participant and plan sponsor contributions. It's called the Covenant PIP, or Covenant Personal Investment Plan. That is for 50% and higher appointments for eligibility. The health care plan, we have Kelly Whittick here. She's going to talk to you about your medical, dental, and vision options, as well as some well-being, really important well-being programs. Some of you might be familiar with HealthFlex. Okay, that is for 100% appointments to be eligible. In addition, we have Carrie Percivali, who will cover the welfare plans. And these benefits, sometimes they're forgotten, but disability through the Covenant Life Options Plan, and that's for 75% and greater appointments. Let's get started by looking at the Covenant PIP plan. This is sponsored by the Global Methodist Church, and as I mentioned, it is a defined contribution 403B plan. It gives you a lot of flexibility. It accepts participant contributions, and I encourage you to make contributions. I encourage you to have a conversation with your financial planner, or if you're eligible for EY financial planning services, should you be doing before tax. Roth contributions are also available. After-tax contributions are available. Now, the plan accepts both plan sponsor matching and non-matching contributions, which becomes an important way to help build up your balances for that day when retirement comes. So let's look a little bit about eligibility and enrollment. Action might be required. Maybe you've done this already. Eligibility is for full-time and part-time appointments at least 50%. This is a mandatory plan. You wouldn't want to opt out. You can't opt out. Local churches can't opt out. And as Rick had mentioned, lay employees are very, very important, and those participants will be able to contribute likely next year in 2024. So there is an action item here. Some of you might have received a letter from Wespath just recently about this action item. You need to enroll in this plan. And if you go to the GMC website at globalmethodist.org, just search It's Easy for the FAQ, the frequently asked questions. And there is instructions as well as your enrollment form or spreadsheet. And I just want to point out, this is what it looks like. It's going to be pre-populated with some compensation information, which is not yours. So the highlighted areas in yellow are what you can change. What you fill in is dark blue. So you want to put your name, you want to put your compensation. It's going to calculate a parsonage of 25%. If you're actually receiving a housing allowance, you want to delete the parsonage calculation and enter the housing allowance. It will add it up for you. And then you want to think about how much you want to contribute to the PIP plan. And when you enter that number in the pastor pension contribution line, it'll automatically calculate to the right a percentage. Okay, that's where the blue arrow is pointing to. Now, I think you want to make sure that that percentage is at least 5%. So if it's coming out lower than 5%, you can go to the left, increase your contribution to bring it up to at least 5% because of the design of the plan. Now, sometimes I call it, and other people have referred to this as the 5-5-5 plan. I encourage you, try to put in at least a personal contribution of 5% or beyond if you're able to. There's a matching contribution because of your personal contributions up to 5%. And then furthermore, the third 5 in the 5-5-5 plan is the GMC non-matching contribution. You get 5% of your plan compensation and no action is required. So if you do this, you'll be getting at least 15% or higher going into your Covenant personal investment plan. It has some important features that you might be familiar with from the United Methodist Personal Investment Plan. Life stage, investment management, life stage retirement income for when you reach retirement. If you are comfortable choosing investments, you can self-manage your own accounts. That can continue, whatever you're comfortable with. Quarterly statements can be found online and on demand at Benefit Access. This plan also will accept rollovers. That really just speaks to the portability of these plans. It accepts rollovers from IRAs, from 403B plans, from 401K plans. When you actually do reach retirement, there's a lot of the same flexible distribution options. You can take lump sums, you can take monthly installments that you self-manage, you can use the life stage retirement income to calculate an amount that you can take out on a monthly basis. Along the way things happen, the plan does have provisions for age 59 and a half withdrawals, as well as withdrawals of any rollover contributions that you made. So just a lot of great features in the plan design. Life Stage, just as a refresher, what I like about Life Stage, well, a couple of things. It helps participants that don't have the time or the interest in self-managing. It will come up with an asset allocation. Everybody in Life Stage has a profile, and I would encourage you to go on Benefit Access, review, and update your profile. In terms of when you're thinking of retiring, we might not know that. Make sure it has a correct indicator for Social Security benefits later on. Indicate what your risk tolerance is. Are you conservative? Are you moderate? Or are you more aggressive with your investment allocation? At this moment, we're going to shift gears and turn it over to Kelly Wittick, and she's going to talk about the Health Flex and Wellbeing programs. Good morning, Kelly.
Good morning, Bob. Thank you. Well, I'm excited to be here. I do have some things to share about the Health Flex plan. I'm going to start talking a little bit about who is eligible to enroll in Health Flex. Currently, the plan has full-time 100% clergy who are appointed to an eligible church, to actually any church in the Global Methodist Church are eligible. And this is also has mandatory aspects of the plan, which means you either, if you're full-time, you either need to enroll in the plan or you need to submit a waiver form that is signed by Rick or somebody in the Global Methodist Church Benefits Office. There are options for people who are eligible for Medicare to waive the plan if that's their desire, but full-time clergy need to take some action, either enrolling in the plan or submitting the waiver form. It was mentioned earlier by both Bob and Rick, but again, those lay employees who are working at local churches, they are important to all of us, and we are targeting sometime in 2024 to be able to bring them into Health Flex and make them eligible as well if the church desires to do that. So let's talk a little bit about the benefit options that are currently available in 2023. So folks who are already enrolled in Health Flex or were previously enrolled in Health Flex, this might look familiar to you. If you're in your 30-day enrollment window, you just became eligible for Health Flex, you'll actually be making a decision about some of these plans. And if you're looking to be appointed 100% to the Global Methodist Church in the future, this is something that you can look forward to. So Health Flex offers 6 medical plans. It's actually medical, pharmacy, and behavioral health. There's 6 to choose from. 3 different types. We have a traditional PPO plan, as well as 3 health savings account plans and 2 health reimbursement account plans. They cost different amounts, they offer different levels of benefits, but all of them have, that ability to protect you in case of a catastrophic health event. So all of them offer that good level of protection if something tragic could happen and you need significant medical care. We also offer up to 3 dental plans, up to 3 vision plans, and then multiple health and reimbursement account options, from health savings account and health reimbursement account to 2 different types of flexible spending accounts. So you have a lot of options. If you look in that toolbox where those documents sit that Bob referenced earlier, you should see a plan comparison document, and that will give you a ton of detail about the different types of plans. So if you're already enrolled, you can get to know your plan a little bit better. If you're in that enrollment window or will be enrolling in the future, that's a great resource to decide what plans are a good fit for you. So how do you pay for HealthFlex? I mean, if only healthcare and health benefits didn't cost us anything, not in this country, is definitely not the case. But the Global Methodist Church and Wespath both have worked hard to make paying for health benefits as affordable as possible for the clergy who serve. So want to talk a little bit about the premiums. They do vary by plan, and the specific details on what each plan costs can actually be found on the Global Methodist page. In those FAQs, it's actually number 8. There's a link there that will tell you exactly how much you have to pay for each type of plan. And then the GMC churches will pay a portion of the plan enrollment, and that's called a premium credit. And that information is on that same FAQ page. And that premium credit varies based on how many people you choose to enroll. So there's a different premium credit if you enroll just one person, the clergy, if the clergy covers another person, either a spouse or a dependent, or if a clergy covers 3 or more people or a family. Anything in excess of the premium credit, so if you choose a combination of plans that cost more than the designated premium credit, that additional amount is the participant's responsibility, the clergy's responsibility to pay. It can be withheld as a pre-tax salary deduction, so it works very, very much to your advantage, your tax advantage, but that additional cost is your responsibility. The participant, you can also choose to make personal contributions to either a flexible spending account or a health savings account. So you have that choice, so you can choose what plans you want to enroll in, and then you can choose what type of accounts you want to contribute to. We do like to encourage people to take a good look. You can use Alex Benefits Counselor. You can look at that plan comparison and take a good look at the different plans and pick the one that makes the most sense for you. Higher cost plans are not necessarily better plans. Even somebody who has significant health expenses can really save money in one of the HSA plans and some of the lower cost plans. So we encourage you to take a look at Alex and really think about what plans you want to enroll in. Don't assume that just because it's expensive means that it is the best plan to enroll in. That is not the case. All right, so let's give you an example of what it looks like to pay for HealthFlex. So this example has a single pastor who's only covering themselves in coverage, and they've chosen the C2000 plan, which happens to cost $989 a month to enroll. They've also chosen to cover themselves in the PPO dental plan, which costs $41 a month to enroll. And then they've chosen the Exam Core plan, which has no additional premium. The premium for that is actually included in all medical plans, so you don't have to pay anything else for it. And then they chose to contribute $100 a month to a flexible spending account, a health flexible spending account. So how does that all shake out? The total premium for the C2000 and the dental PPO will come up to $1,030. So that's the total premium cost. The church is responsible for $841 of that. That's the premium credit. So the remaining portion is $189 a month, which is billed to the church and should be withheld from the pastor's salary. But the $100 flexible spending account contribution will also be billed to the church and withheld from the pastor's salary. So each month the pastor is going to pay $289 to be in this combination of plans in 2023. In another example, let's say a pastor is covering a spouse or a child, and now they're electing two-person coverage, and they've chosen the H3000, so that's the lowest cost plan option. The premium to be on that plan is $1,445 just to be on that plan. They've chosen to waive dental for whatever reason. Maybe they have dental coverage elsewhere, or they have a local dentist who does their wellness and they just pay out of pocket. So they're not enrolling in dental, and again, they're enrolling in the Exam Core Vision plan. And they have chosen to contribute $300 a month to the HSA. They're saving some money on that H3000 premium, so they want to make sure that they are building up a good HSA savings. So in this case, in this example, the total premium is $1,445 a month. The premium credit is higher because there's two people covered, so the church will pay $1,597 a month. And you can see that's more than the total premium, right? So the pastor does not lose that additional amount. The excess premium credit, the $152 extra left over, is deposited into an HSA on the pastor's behalf every month. And then the participants portion is $0 for the premiums, but they do have $300 a month that they've chosen to contribute to the HSA. And so that $300 a month will be withheld from their salary, and that's on a pre-tax basis. So that gives you a couple of examples of how the premium credit and the premiums work for HealthFlex. I do want to assure you, whether you're currently enrolled in a HealthFlex plan, whether you're currently enrolling in a HealthFlex plan, or whether you expect to enroll in the future, all of these plans are extremely comprehensive and cover significant types of services and expenses that can be incurred. Every single one of our plans gives you your choice of doctor or provider. You don't need a referral to see a specialist. They're not HMO medical plans. You can choose who you want to see in or out of network. They do all use the nationwide Blue Cross Blue Shield PPO network. That's a very broad network. It allows you to get care anywhere in the country that you choose to receive care. Blue Cross's PPO network is very broad. Do you have to use a provider in the Blue Cross network? You don't, but the benefits are significantly better, and again, that network is really strong. So we strongly encourage people to take advantage of that network and choose an in-network provider. Every single plan uses the same prescription drug formulary. A formulary tells you which medications are covered by the plan, as well as how much of the medications are covered. Every single one of these plans uses the same premium formulary at OptumRx, and they also access the same retail pharmacy network. All these plans have comprehensive well-being programs, which I'll talk a little bit more about. They offer MD Live virtual visits for both acute care needs like ear infections, a dermatitis, or behavioral health. You can do virtual behavioral health care, and at no cost to you. Every single one of these plans offers that MD Live telemedicine service at no cost. And then very exciting, in 2024, we'll be introducing care coordinators, and that's something I'll share a little bit more about, but you'll hear way more about that as we go into 2024. So again, all of these plans are really great plans. Even if it's a lower cost plan that pays a lower percentage of certain services, they're still very comprehensive plans. When you enroll in HealthFlex, you will receive in the mail a Blue Cross Blue Shield medical card. It will look a little bit different in 2024, but this is what it looks like in 2023. This is the card you use for all medical, behavioral health, and pharmacy expenses. So you just hand them this card. It has the Blue Cross little PPO suitcase on it that tells you that you can use it with any Blue Cross provider. You may also, if you choose a plan with a health reimbursement or a health savings account, or if you choose to contribute to a flexible spending account, you may get one of these cards in the mail from Health Equity. So the teal card is for health reimbursement accounts, which comes with the C2000 and C3000 plan, or if you contribute to a flexible spending account for healthcare. So you'll get that teal card, and you'll be able to use that at point of service to access your funds. The purple card is a health savings account card. If you enroll in an HSA plan that comes with money, you will get that purple card. I hope that if you have a health savings account option, that you're also contributing to the health savings account, and all of your plan contributions and your personal contributions will go onto that card. We don't use mailed cards for dental and vision unless you enroll in the dental HMO. So the dental HMO, you will get a card mailed from Cigna. It'll have your name and your primary care dentist's name on it, but otherwise you will not have a card mailed to you. Once you're enrolled in HealthFlex, for those of you who are enrolled in HealthFlex, if you have a question or a concern about a service or a claim, if something just doesn't feel right with OptumRx or Blue Cross Blue Shield, we hope that you'll contact Wespath. We have an active benefits team that provides incredible handholding and service and can help you navigate different difficulties that you may have with HealthFlex. Healthcare is not easy. There's all sorts of challenges and hoops to jump through, and Wespath can help you through that process. And excitingly, I mentioned this before, beginning in 2024, we're going to add an extra layer of service, Wespath care coordinators that will really provide fantastic support through all phases of the healthcare and health benefits journey. Very excited about that. I mentioned that HealthFlex has a very comprehensive set of well-being programs. If we look at the lower right side of the screen, the Blueprint for Wellness Screening, it's a blood draw. Nobody really likes needles, but this is an extremely comprehensive blood draw that's available at no cost to you, primarily through Quest Labs, but it's possible to get a kit that they send to your home. We do incentivize $100 for taking this screening. You just have to do it by the end of August. So if you are enrolled, you have about 10 days left to do it. So go ahead and don't miss that opportunity. And then our health check is our digital health assessment on the Virgin Pulse site. Again, if you are already enrolled, especially if you enrolled before April 1st, make sure you do that by the end of this month. You've got 10 more days. We don't want you to have a higher deductible in 2024 if you miss doing that. So again, if you've already been enrolled since April in HealthFlex, make sure you do that in the next 10 days. And then you can see over on the left side just a ton of other comprehensive well-being programs, incentives. We have very strong performing diabetes prevention and diabetes management programs through Omada. We have health coaching that can be done telephonically, 8 free visits with a counselor through our employee assistance program, Weight Watchers partnership, and then I mentioned the no-cost telemedicine services through MD Live. So really fantastic well-being programs. They all start at Virgin Pulse, so if you're not already registered and you're enrolled, make sure you do that. If you are registered, log in, explore. There's so much available. One more reminder for folks who are enrolled this year, either already enrolled or will enroll before the end of the year. We have $150 up for grab in Pulse Cash that's available. All you have to do is get 150 wellness credits. There's tons of ways to get wellness credits. You can scan the QR code, log into Virgin Pulse if you're already eligible, and look at the various ways, and don't leave that $150 on the table. And then my final reminder is that annual election for 2024 is coming up at the beginning of November. So if you are enrolled in HealthFlex at that time, be on the lookout for various communications. You'll be electing your 2024 benefits. You can change plans. We have some plan changes coming with the HSA plans. We'll have a new Alex Benefits Counselor available to you. So don't miss that date. And then be excited. Coming in January, we have those care coordinators that are really going to provide fantastic assistance for you. We're really excited about that program. Well, that's about what I had to share, Bob.
Thank you, Kelly. Really exciting about the Wespath care coordinators.
Yeah.
Do you have time for just a few HealthFlex questions that came in? And sometimes we get asked this question about the benefit cards, the different color cards. Somebody asked when they would expect to receive those benefit cards.
So once you're actually enrolled in the plan, and Rick mentioned, there are various steps that need to be taken before you're actually enrolled in your benefits through Wespath. And that window is definitely shrinking, we're seeing, so that's good news. But once you're actually enrolled, it can take a couple of weeks to actually get those cards in your hand. I do encourage you to go to Benefits Access and log in, because once you're actually enrolled, the following Friday after being enrolled, you can actually click on Blue Cross, click on Health Equity, and you can access a digital card. You can access a digital card through the Cigna Dental program. So you don't have to wait for that physical card to come in the mail. And then the other thing that we say is if you feel like you're enrolled and you just can't wait for that card, call Wespath. Let us help you. We can figure out how to get you a temporary card so you don't have to wait for that.
Excellent. This question is interesting. Will we lose HealthFlex coverage in the gap between leaving the UMC and joining GMC? Okay, and one more. Can the church choose to pay for 100% of the pastor's costs of HealthFlex, or do they need to stick with what's been laid out
So
here?
I am not in charge of making rules for churches. I would strongly encourage the church to stick with the premium credit. And there's a couple of reasons for that. We feel like there are good plans to be looked at, and the limited premium credit helps you take the effort to look at all of the plans, not just the most expensive plans. So there are real benefits to choosing some of those HSA plans. And the other thing is if a pastor came in the future, or if you went to a different church in the future and they didn't pay for 100%, that could be disruptive for you. So we encourage the churches to pay the premium credit, but we don't make the rules.
Understood. Thank you very much, Kelly. Next up is Carrie Percivale, and she's going to talk about the Covenant Life options. And these are really important benefits. Hopefully, you won't need to use them anytime soon, but long-term disability and life insurance coverage is just a real important benefit. Hi, good morning, Carrie. Appreciate you joining us.
Thank you. Thank you for having me. Good morning, everybody. As Bob said, my name is Carrie Percivale, and I'm the Welfare Plans Manager here at Wespath. And we're going to talk a little bit, just for a couple minutes today, about some of your benefits through the welfare plans, which is your life and disability benefits. Covenant Life Options offers 3 different types of insurance through Unum. There's a long-term disability benefit, as well as the basic life insurance benefit. Both of those benefits are church paid and automatic. Then we have the optional life insurance benefit, which we'll talk about in a few minutes, that is participant paid. In order to be eligible for Covenant Life Options, clergy must be enrolled in serving at least 75%. Coverage is mandatory, you can't opt out of it, and enrollment is automatic. So as soon as our system identifies you as a Global Methodist clergy, your information is automatically sent over to Unum, you're automatically enrolled in the plan, and there's nothing that you'll need to do. Approximately 2 weeks after you are enrolled in the Unum plans, you'll receive a welcome letter that will also let you know how you're able to go online and update beneficiaries. Taking a look now first at the long-term disability plan. This, once again, is a church-paid plan that is automatic if you are eligible. If you are disabled from Unum, your monthly disability benefit is equal to 60% of your plan compensation. Benefits begin after a 90-day elimination period. If you are disabled, Unum will continue to contribute to your retirement plan. There are also very generous return to work incentives. Looking now at the life insurance, this is the basic life insurance that the Global Methodist Church offers, and that is church paid. Should something happen to you, your spouse, or your child, there is a benefit that is payable. There is also a benefit for retired participants if you meet the Global Methodist Church eligibility. The life insurance offers an accelerated death benefit, as well as portability and conversion available if you were to terminate coverage prior to your retirement. There is also phone-based grief counseling as well as financial counseling. The optional life insurance. This is a third part of the Unum offerings that the Global Methodist Church is providing. This is coverage that you are paying for directly with Unum if you choose to elect it. If you had this type of coverage under the United Methodist Church, you must re-enroll as a Global Methodist Church clergy, but the rates will be the same. So you will not see an increase or a change in your rates that you had when you were a UMC clergy. I had mentioned earlier that after about 2 weeks after your information is sent over to Unum, you'll receive a welcome letter. In that welcome letter, along with instructions about how you are able to update your beneficiaries, that is when you will be able to elect this additional optional coverage. If you elect coverage within the first 60 days of receiving that letter, you are guaranteed issue up to $100,000 of coverage for a clergy, or $25,000 for a spouse and a child. If you wish to elect coverage beyond that, or if you elect coverage outside of those 60 days, you may be subject to evidence of insurability, which in this case is just a questionnaire. You may also be denied coverage. This insurance is between you and Unum will bill you directly. If you have any questions or you're having any sort of difficulties with your insurance, I encourage you to please call Wespath. Please call my team, and we're here to help. Back to you, Bob.
Thanks very much, Kara. Really, really important information. Appreciate you covering that. Next, we're just going to review the process of moving from UMC to GMC, and we're going to bring back Rick Van Giesen. Rick, welcome back. We're just going to review the process that we talked about a bit earlier, and it seems to be, multi-step, multifaceted, and I think just worth going over again. Someone's moving from UMC to GMC, and we've seen that. So typically, the clergy person will withdraw, surrender their credentials to the UMC, and then there's a bit of a process there at the conference office to notify Wespath of that.
Just to clarify, what is usually asked for by the conference is the certificate of conference membership that was issued to the clergy person when they became a conference member. Not many of clergy were actually issued that certificate. I never got one. And so the different conference offices have put different stipulations in place in order to make that withdrawal official. But you are absolutely correct that the first step for the clergy person who wishes to transfer will be to issue a letter of withdrawal under paragraph 360. That usually goes to the bishop's office. If the bishop's office needs to relay that to the cabinet or to the Board of Ordained Ministry, they will. That information eventually gets to the conference benefits officer, where it is incumbent on conference benefits officers to enter that withdrawal into Wespath's database, because Wespath cannot begin the process of moving that pastor from UMC to GMC until they are released from the UMC. Then once Wespath's process, we call it conversion, which is kind of a curious process, a curious name for ministers. But once that conversion is done, then Wespath informs us that that pastor is ready for pension and HealthFlex enrollment. And then once we place that into Wespath's hands, Wespath takes it from there.
Yep. So it's quite a few steps, a lot of important steps along the way, and that DBDC conversion, and that will appear as a balance if you've gone through that conversion. And again, it usually takes 10 to 11 business days, but you'll see that ultimately come out as a balance. So a lot of steps along the way. Rick, some optional information. Again, we're going to point out the resources that are available. I want to remind everyone, if you've never registered for benefit access, really, it's a good time to do so. The registration process is easy, and it's really one-stop shopping for all of your information on the life and disability plans, the retirement plans, and if you're in the HealthFlex plans as well. I continue to encourage participants to utilize, if you're eligible for EY financial planning services. A lot of participants have been helped by EY. I've used EY. Questions you can ask EY. We talked about the personal investment plan. How much should I contribute? Okay, they can help you make projections on your retirement balances, but also help you decide if you should be doing before tax, or maybe if you're a younger clergy person, considering Roth contributions, which can be an important source of retirement income, potentially tax-free income. The things I like most about EY, a couple of things. There's no direct cost to a participant. Those costs are paid by Wespath's operating expenses, and they're not trying to sell you anything, Rick. They just have no sales pitch. They have a service to provide. They also have a terrific website, eynavigate.com. You can register and just get a lot of financial planning information, and it is geared to the unique, special situations of clergy. So I want to pitch to we've done this program for a few years now, and it began at the time of the pandemic, but not because of the pandemic. Often we'll be on site, the benefit education team, and sometimes there's just not enough time to sit down with everybody individually. So we continue that when we're back in the office with virtual benefit education consultations. I've been in a lot of parsonages the last few years. Your spouse can be on these consultations. It is private. It is secure. We'll make sure we're talking to the right person. There is a link here. It's easy to register. We usually have slots available for the next 8 or 10 weeks, sometimes 2 months, and we want you to pick a spot that works for you. You'll receive an invitation, and then you'll see either me, Todd, Frank O'Brien, or Cheryl, and we'll help you. We can share the screen. We can run benefit projections. Rick, we did get a few questions if you have time.
Of course.
A couple interesting questions came in. Some of these were just not so much questions, but comments. Someone said, congratulations, Rick. Someone said you should be retired. What happened? What went wrong? So I don't know if that's a question we can actually answer.
Well, sure. I warned pastors when they were retiring about this for years, that the most difficult challenge in retirement is not financial. And of course, that's because of the very generous pension benefits from Wespath. The biggest challenge is going from being needed to not being needed. And even though I warn pastors about that continually, I experienced it myself. I was not ready to retire when I retired. I felt like I still had gifts to give, and the Lord works in mysterious ways. Some of you know Reverend Bob Phillips. I met with him at lunch in the very beginning of the formation of the WPA. And I said, Bob, I want to help. That in itself is a good feeling, but it will be good to build a team that can take it from here.
Yes, and I think you definitely are needed. I certainly needed you here for this webinar, so I appreciate you. A couple of questions came in about the PIP plan. What is the maximum I can contribute? And you do see that sometimes clergy, when they're kind of in the home stretch, they'll really run this plan high. And on your enrollment spreadsheet, it does state the maximums. If you're over the age of 50, it's even higher. You can contribute up to $30,000. If you're 50 or below, it's $22,500. And someone's asking, do they have the flexibility to change that contribution? Like if they ran it high, they can always adjust it.
Absolutely, absolutely. What we would like is another pension form sent to us with the change in the contribution, and we'll put that in right away.
Yeah, and I think that's important about the Covenant PIP plan is that you do have that flexibility. You're not locked in for any extended period of time. You have that flexibility to make a change. Someone asked about, can I choose another different plan in HealthFlex during the annual enrollment period? Yes. As Kelly said, that's an opportunity to maybe consider one of the HSA plans. Here's one. Can a GMC elder who currently serves as an independent but considering GMC in churches participate in the retirement plan just yet?
No, sorry. If, our saying is that GMC benefits are for GMC pastors who are appointed to GMC churches. And so we certainly hope that your church will decide to come into the GMC, and we'd be very happy to offer you benefits when that occurs.
Excellent, excellent. The pension form that we looked at before, that enrollment spreadsheet, it designates 2 lines there for church contributions. Is one for the local and one for the denominational contribution? Is that?
No, all the church contributions come from the local church. The Global Methodist Church doesn't contribute to that match or to the base. Everything comes from the participant and from the local church.
Okay. Someone asked Rick, we're out on the West Coast where there is no conference person at this time. Mm-hmm. This might get a little involved, but how are we to build and remit funds without an actual conference person?
Well, you're not going to remit funds to the conference anyway. both for HealthFlex and for the pension plan and for the Unum plan, you'll be billed by my office, the GMC office, and you will pay to the GMC, and the instructions for payment are on the invoice. You can pay by check to the address on the invoice, or you can pay on the bill.com platform, and the web address is on the invoice.
Excellent, excellent. If I were retired UMC, but now in GMC, a GMC clergy member, do you need to transfer any pension funds or information?
No, if you are a retired UMC and your benefits have been set up, there's absolutely nothing you need to do. Those will not change; they will stay the same, and so there's nothing you need to do in terms of transferring that pension from UMC to GMC.
Got it. Yep. Rick, this has been really great having you here. I think we've answered all the questions that have been raised up. I would remind everyone to be patient, have grace. The process does work. We've seen a lot of people actually come through it with, well over 1,000 already set up in the Covenant PIP plan. For those of you that have received a letter, please take the action that's been asked for. Fill out those enrollment spreadsheets. Remember that Wespath continues to be here, caring for those who serve. You will be receiving a follow-up email, which will have a link to this recording. I think it's just been great to see everyone. Many of you I've seen in your days in the UMC, and we look forward at Wespath to continuing to serve and care for those who serve in the GMC. But I want to thank you for joining us on this webinar today. It's been excellent. And Rick, I really, again, thank you for being here. Appreciate you taking the trip up.
It's been a pleasure. Thank you.